This is Josiah Kamler's informative speech.
Should have titles, should have authors, should have stars, should have some sort of picture, and it's one sentence.
Imagine having a burning sensation in your eyes due to contacts or the uncomfortable feeling of glasses. Those who experience these feelings think about getting laser eye surgery. People choose to have laser eye surgery because it prevents the use of contacts and glasses. A better understanding of laser eye surgery can be gained by understanding the purpose, procedure, and risks of the surgery. I will first discuss the purpose of laser eye surgery, also known as LASIK. There are three main reasons on why people choose laser eye surgery. The first reason is to correct nearsightedness in their eyes. In the article entitled LASIK Eye Surgery by Cameron D. Yanoff, published on Medline Plus on March 15, 2016, explains, nearsightedness happens when light entering the eye is focused incorrectly, making distant objects appear blurred. If someone is nearsighted, he or she cannot see things that are far away, but can see things that are close to him or her. Symptoms of nearsightedness may include squinting, which does help faraway objects seem clearer, eye strain, or headaches. People who are considering having LASIK should wait until their nearsighted condition has gone down. If one has surgery on the nearsighted eye, they may end up with a lazy eye. The second reason is to correct farsightedness. Farsightedness is defined as able to see objects better from a distance than from short range. In other words, farsightedness is when a person cannot see things up close, but can see objects that are far away. Symptoms of farsightedness include aching eye, blurred vision when looking at close objects, crossed eyes, eye strain, and headaches while reading. Farsightedness is commonly corrected with glasses or contacts. The last and final reason people choose to get LASIK is to fix astigmatisms. Merriam-Webster defines astigmatism as a defect in the eye or in a lens caused by a deviation from spherical curvature, which results in distorted images as light rays are prevented from meeting at a common focus. In case you didn't understand all that, astigmatisms happen when light rays entering the eye are not uniformly focused on the retina, causing objects to appear blurry. Most people get laser eye surgery so they can avoid wearing contacts or glasses and still have 20/20 vision. Not only is it important to discuss the purpose of laser eye surgery, but it is also important to understand the procedure. Surprisingly, the procedure of LASIK is very short. Before the surgery is started, doctors perform an eye exam that will ensure the eyes of the patient are healthy. After the first eye exam, more tests will be done to measure the curvature of the cornea, pupil size in light, pupil size in dark, the eye's refractive error, and the thickness of the cornea. After all of these tests, the patient will then sign a consent form. Included in the consent form are the risks of the procedure, benefits, alternative options, and possible complications. After the signing of the consent form, the doctor will give sedative for relaxation, since the patients will remain awake for the procedure. Once the sedative gets into the patient's system, the physician will give eye drops to numb the eye. When the eye is numbed, the doctor will use a small instrument to prevent blinking. After all these tests are done, a laser will go around the eye. This step will last around 10 to 15 minutes, and then the surgery will be done. When the surgery is over, the patient may have a burning, itching, or a feeling that something is in their eye. In the article entitled LASIK Eye Surgery, published on Medline Plus by Cameron D. Yanoff, states, this sensation should not last for more than 6 hours. An eye patch will be used to cover the eye for protection and will help prevent rubbing or pressure until it has healed. The eye will normally heal overnight. If the patient does rub their eye, the flap might become dislodged. The doctor will also provide medicine and another sedative to help with pain. The patient's vision will be blurry throughout the duration of the day of surgery. By the next day, the patient's vision should return back to normal. It is important to avoid these activities after surgery: driving, swimming, hot tubs or whirlpools, and contact sports. If a woman got the surgery done, it is also important to not use lotions, creams, and eye makeup for 2 to 4 weeks after surgery. Now the risks of laser eye surgery will be introduced. Although laser eye surgery is very helpful, there are also a lot of risks. The worst risk is the possibility of permanent vision loss. The most common effect from a risk is corneal infection, corneal scarring, and/or problems with the cornea's shape, which makes it impossible to wear contacts. Another risk is certain objects may appear fuzzy or gray. Other risks include dry eyes, glare or halos, light sensitivity, night driving problems, patches of red in the eye, and scratchiness in the eye. People who are pregnant or breastfeeding should not have LASIK because it could affect the eye size of the patient. Also, people who take Accutane, Cardarone, Imitrex, or oral prednisone should avoid laser eye surgery. If the surgery doesn't go as planned, your vision may take up to 3 to 6 months to come back. If your vision does not come back within that time period, another surgery may need to be performed to correct it. Although the second surgery will correct LASIK, it may not solve problems with glare, halos, or nighttime driving complications. In the article entitled Laser Eye Surgery, published on Wexner Medical Center by Richard Harrington, a professor at Ohio State University, states, people who get LASIK done will still need to have reading glasses around the age of 45. As you can tell today, people choose to have laser eye surgery because it prevents the use of contacts and glasses. A better understanding of laser eye surgery can be gained by understanding the purpose, procedure, and risks of the surgery. Next time you feel irritated or annoyed with your glasses or contacts over a long period of time, I suggest you think about laser eye surgery.